If you are a stroke survivor or if you are a caregiver, then this video is a must watch for you, because in today's video what I'm going to share with you are the 6 important benefits of encouraging early mobility in stroke survivors and 6 tips that will help you to attain this early mobility. Let's get started. About the importance of the early mobility, let's first understand what exactly is stroke. Stroke is a very sudden, severe brain injury. The injury is not a physical injury, but there is a damage due to stoppage of the blood supply, due to an ischemia. What does that mean? Is due to the blockage, the blood suddenly stops moving to the brain, or else there is a hemorrhage, which means there is rupture of a brain artery, which will lead to cell death. A very big impact on their physical functioning, not only from the movements aspect, but sometimes from a communication aspect, sometimes from a swallowing aspect, and sometimes even from a cognitive aspect. The importance here is to work on encouraging early mobility, because motion or movements have proven that helps early recovery, at the same time attain holistic well-being. Let me talk to you about the 6 important core benefits of early mobility in a stroke survivor. The first important benefit of starting early mobility in a stroke survivor is about prevention of complication. When a person suffers from stroke, he is likely to develop complications like deformities, stiffness, pressure sores, etc. But if we start mobilizing the patient early, the chances of developing this complication reduces. That takes me to the next point, which is restoration of function back. When a patient suffers from stroke, he will have some functional challenges like inability to move by himself, inability to lift the hand by himself, inability to lift the legs by himself. They won't be able to sit independently, walk independently, so on and so forth. But if we start early mobility, the development of these movements, this function starts happening, because brain starts working again. Neuroplasticity starts coming into picture, and thus helps a patient to recover faster. That takes me to the third benefit of early mobility, that is cognitive benefit. Yes, when a brain cell damage happens, it will not only have an impact on the physical function, but also have an impact on the cognitive function, which means the ability to understand, the ability to comprehend, and ability to communicate. When you start early mobility, the patient's ability to comprehend and understand starts happening, because the awareness about the movement starts happening. Patient starts observing with the hand, with the proprioception, with the eyes, how these movements are happening, thus helps in improving cognition. Coming to the fourth benefit is safety consideration. Now, definitely when a patient is suffering from stroke, there is lack of balance, there is lack of stability, there is lack of movement, which means there is a very high risk of falls and injuries. But when we start early mobility, the patient starts developing back the balancing function. The balancing centers in the brain, which is your cerebellum, also starts getting activated. Patients start developing methods and his own ways of maintaining balance. And that's why it's very important to start early mobility activities. That takes me to the 5th benefit, and that is overcoming challenges. Yes, a life of a stroke survivor is full of challenges. It's so easy for us to sit right now, to stand anytime, to walk, to do anything that we want. But even the smallest task of lifting the hand or holding something in the hand becomes difficult for a stroke survivor. But when we encourage the patient to involve into early mobility activities and action, the brain starts working. The brain starts problem solving, and that helps in patient to develop his or her problem solving ability. As the patient develops his or her own strategies to overcome these challenges, the brain cells or the neurons also starts multiplying, and thus helps in improvement much faster than for someone who don't move at all. And the last but not the least benefit, the 6th benefit of early mobility is cardiovascular and musculoskeletal fitness. Imagine you are on bed for more than 1 month, maybe sometimes 6 months, or maybe sometimes 1 year. What will happen to your cardiorespiratory fitness? What will happen to your musculoskeletal fitness? Definitely it's going to get compromised. But there's only one way to prevent all of these things to happen, and that is early mobility activities and exercises. So, these were some of the benefits of early mobility activity and exercises. Now, let me share with you some 6 important tips to encourage early mobility in a stroke survivor. So, the first tip that I would like to recommend is work with a physiotherapist. Physiotherapist is an ideal professional when it comes to developing early mobility. Physiotherapists study very detailed. Physiotherapists, especially neuro-rehabilitation physiotherapists, study about stroke rehabilitation in very detail. They exactly understand what are the kind of impairments that the patient will experience or have depending on what brain area was under damage. Due to this, they are able to come up with a very structured and strategic rehabilitation plan and protocol. Hence, the first thing that definitely you should do is the moment a stroke survivor is out of ICU, or even when the patient is in ICU, physiotherapy is started. The sooner we start the physiotherapy, the better it is for the patient. So make sure to work with a physiotherapist in a very close manner. That takes me to the second tip that I would recommend here, and that is to set realistic goal. Now, many a times we have seen in our practice that patients and the caregivers have this expectation that in 1 or 2 months the patient will be absolutely alright, they will be walking, they start comparisons. But unfortunately, brain is the only organ where even today humankind have not unraveled all its secrets. Every brain is different, every individual is different, and that's why every recovery story is also different. Hence, it's very important not to set some unrealistic goals and expectations, because eventually what will happen, that leads to a lot of depression and anxiety. Hence, it's better that you talk to a physiotherapist, set some realistic goals based on the kind of damage that has happened to the brain, and then work gradually over achieving it. The key here is patience and consistency. The more patient and more consistent you are, the better is your outcome. That takes me to the third tip, that is, use mobility aid as and required. Whenever a stroke patient is trying to sit independently, walk, all of that, there will be requirement of some support. And that's where, without hesitation, use your mobility aids. Fourth tip is perform passive movements. Now, passive movement is the great way to start early mobility. The best way to start is with passive movements. Make sure each and every joint is moved so that early mobility can be attained. Make sure to keep the exercises gentle. When a stroke survivor is doing these exercises, since the muscle tone is not right, there are very high chances of injuries and damage. And that's why it's very important to be mindful in keeping these exercises gentle. Even when you are transferring the patient, you have to be very careful that there is no damage that has happened on the joints due to wrong handling. Do you know that stroke survivor most of the time develop shoulder injuries just because of wrong handling? And that's why it is important that you learn right handling technique from the nurses, from the hospital, or the physiotherapist who is working with you, so that you prevent the damages as much as possible. And that takes me to the sixth point and the last tip that I would like to share in this video, and that is, make sure to change the position of the patient frequently. Ensure that you turn the patient every 1 hour on each and every side. The 3 benefits of this is, number 1, the awareness of different body area will be improved. Patient have one-sided neglect when he or she suffers from stroke. If we want to reduce that, the best way is to do the position changes. Second thing, it will prevent pressure sores. When a patient is sleeping on one side for a very long period of time, there's a lot of friction that is happening between the skin and the bed surface. That leads to a very high risk of pressure sores, which can be very easily prevented just by regular turnings. And the third benefit of doing this is to ensure and encourage spinal movement. Whenever you are turning the patient side to side or changing the position, the spine muscles are getting activated. Spine muscles are the first to recover and develop movement, and that's how the progress of movement happens. So first the spine movements will develop, later on the hand movements will develop, then the finger movements will develop, so on and so forth for legs as well. So friends, make sure to follow these 6 steps and ensure to develop early mobility habits if you have a stroke survivor at home or you are a stroke survivor yourself. I hope this video was helpful. I would love to hear your feedback on this video, so make sure to comment in the comment section below. I'll see you in another video. Thank you.